was asked to review the evidence for preventing suicide on the railways by NHS England and NHS London. I was asked to do this as part of CareIF and as part of the Cultural Consultation Service. Essentially, there had been 2 previous reviews and they hadn't been updated since 2010, and indeed the data included in them, I think, originated from way back in 2008. Gradually, there'd been increasing concern about suicide on the railways, and the data are conflicting. There was some data in the press suggesting that the numbers of suicides were increasing, for example, on London Underground. But the official statistics appear not to suggest that, and suggest that actually there's been not much change. And part of the problem is we don't really have a standard reporting framework which looks at who is classified as killing themselves by suicide on the railways and who's had an accidental injury. There's also very little data looking at age, gender and ethnicity and other demographic variables. So there's no standard reporting framework. Contrast this with the National Confidential Inquiry into Suicide and Homicides by the mentally ill, particularly amongst those who've had contact with services, and we've got a fantastic national data set. So part of the problem is we don't really have good data, and there's concern about that. The additional problem is we know that suicides on the railway cost the railways and the passengers a great deal of money. They are costly in terms of personal tragedy to the families of those victims and, of course, the victims themselves. There have been some suggestion that people who kill themselves on the railways tended to be people who had been in close proximity to psychiatric hospitals. Although that's a convenient and very plausible explanation, the evidence is not straightforward, and it looks like some studies have shown that people who kill themselves on the railways have been in recent contact with mental health services, and some of the hotspots are near mental health services. But also there's conflicting data if you look at the international literature. We know from the wider suicide literature that suicide is not only caused by mental health problems, but can occur suddenly and unpredictably, particularly when people face social strain or financial strain, when they're in distress, when they had a sudden life event that they've not been able to cope with particularly well. And so there's a degree of impulsivity involved. And so when we begin to think about how to prevent people from taking their lives on the railways, we really have to think not only about predictable things, for example, if they've been in contact with services, and can the services do more, can they provide more crisis outreach, more home treatment, but also what do the railway authorities themselves do in reducing the risk of suicide? How can they reduce impulsivity? So some of the findings of the report that we're due to launch very soon suggest that there are things that can be done, and some of the things have already been done in railway venues. For example, on the Underground, there are barriers at the front end of the station where the train comes in, because it's been shown that's where people jumped most often and they were more likely to die. There are recesses in the floor of the Underground trains and stations, and those provide some possibility of someone surviving jumping. And where they have got those, more people survive. And so that's actually something to be engineered into future stations in the future. There is a problem about other specific interventions. For example, there was a study in Japan looking at blue light, saying it had a calming effect. But there's no real evidence to introduce this, and it could be that this is false reassurance if we did this, and a waste of money. Barriers have been shown to be particularly effective and exist on some lines. But again, the argument is that it's expensive to introduce barriers everywhere, and do we really need them? And do they make for more inconvenient travel? Given that some of the reasons for killing yourself on the railways are not predictable and people do it impulsively, how do we create an environment which is less impulsive, more nurturing, more caring? Should we be monitoring crowding more carefully on stations and reduce levels of crowding? Should we encourage stations themselves to become more like health and well-being centres and places with lots of advertising, which is nurturing and supportive and caring, rather than harsh places where nobody looks at each other or talks to each other, and health messaging is not common down there. So we hope in the report we'll be provoking individuals into thinking about how to respond to their personal challenges and organisational challenges, professionals in particular. This does present some challenges also to commissioners of NHS services who the police say, and certainly the Transport Police suggest, could be doing more in supporting them, for example by providing crisis outreach services and home treatment services. And this really means, given the change in commissioning taking place at the moment, that there is an opportunity to get this right for the first time, and particularly as the British Transport Police and NHS services are now in dialogue through NHS England.